At our Women's Wellness Center, we understand a woman's life and its many transformations so that you can be sure that you are in caring, curing hands, no matter which stage of life you're in. We are equipped with everything you need, from pap smear tests to digital mammography, to help you lead a healthy, happy life, be it consultation, diagnostics, treatment, or even guidance. Lanka Hospital's Neurosciences Unit is a highly sought-after, comprehensive, state-of-the-art facility in the country. Cutting-edge equipment such as a neuro-navigator nerve monitoring system and the 3DC arm has made the center on par with the best centers in the region. The Neuroelectrophysiology Lab has the latest technology to perform all types of EEGs, EMGs, and sleep studies. This is our Center for Blood Disorders, probably the leading center in Sri Lanka, offering comprehensive diagnostic and treatment facilities for all blood-related disorders, including blood cancers such as leukemia, myeloma, and lymphoma. Our dedicated treatment facility comprises of chemotherapy for all blood cancers, including bone marrow transplant treatment. No matter how simple or complex a procedure, undergoing surgery is an overwhelming experience. Knowing you're in a safe environment with the care of highly skilled medical experts will put your mind at ease. Our fully equipped surgical unit comprises of a surgical ICU and high-dependence unit with state-of-the-art facilities such as laparoscopic and other equipment, on par with renowned surgical centers in the world. The Radiology and Imaging Department of Lanka Hospitals is by far the most impressive in Sri Lanka. It comes complete with the latest 3 Tesla MRI, performing advanced neuroimaging and whole-body MRIs, a modern CT scanner, dedicated ultrasound scanners, DEXA scanners, X-ray and fluoroscopy facilities. We remain the only private healthcare provider in Sri Lanka to offer nuclear medicine for diagnostic, therapeutic and preventive care, equipped with the state-of-the-art dual-detector gamma camera. We believe that good health is an outcome of sound well-being. A balanced diet, regular exercise and preventive screening combine to help with a long, happy life. Our Health Check Clinic, better known as HealthLink, offers many services to help you get there. We also offer gift certificates, allowing you to gift your loved ones with a health checkup. Our Mother and Baby Care Center provides a personalized birth experience for every expecting family. From conception through pregnancy and delivery, postnatal and pediatric treatment come with the comforts of home, the security of expert hands and cutting-edge technology. Rest assured, we will be there from the beginning to help see you and your baby through the most important stages in life. This is our emergency treatment unit, where things happen with clockwork precision. With minimal waiting times and a dedicated unit run by experienced doctors, you are in the best hands. 24 hours a day, 7 days a week, our team of doctors and nurses are ready to attend to the needs of both walk-in patients and ambulance evacuees. Our eye clinic pioneers the advanced corneal transplant surgeries in Sri Lanka. We are equipped with high-quality modern ophthalmic technology to perform cataract, corneal, glaucoma, vitreoretinal surgeries, LASIK and other laser treatments. Here at our groundbreaking ENT center, we perform many complex inpatient and outpatient procedures every day. Our comprehensive and specialized ENT center offers consultations, audiology services, speech and language therapy, and ENT surgeries under one roof. We are the pioneers in cochlear implant surgeries and KTP laser ENT surgeries. backed by superior technology and renowned ENT surgeons. We like to give you reasons to smile. Our dental clinic is all about advanced, thorough and affordable smile care. We provide a full range of services that include general dentistry, cosmetic, laser, restorative dentistry, orthodontics and oromaxillofacial surgeries. Backed by dental X-ray with a 180-degree scanning OPG and modern dental equipment. At our cosmetic clinic, we help redefine lives by offering you world-class surgical and non-surgical cosmetic treatments performed by the best panel of specialized surgeons in Southeast Asia. Our emphasis on confidentiality, affordability and aftercare has won us the trust of patrons from around the world. Lanka Hospital's expert care has garnered us many accreditations and awards over the years. We are recognized with Joint Commission International Accreditation and its Gold Seal of Approval for meeting the highest quality and safety standards. We are also the first hospital in Sri Lanka to be certified by Medical Travel Quality Alliance with International Medical Tourism Certification. We were the only healthcare provider to be recognized with a Merit Award in the large-scale category at the National Quality Awards, as well as World-Class Global Performance Excellence Award. Ratings Lanka gave Lanka Hospitals an A+ and P1 rating. We are the first Sri Lankan hospital to receive ISO 15189-2007 accreditations for laboratory services. And we are the first healthcare provider to be accredited with the ISO 22000-2005 standard for food safety management. Our attention to the environment has also won us the Merit Award for Energy Efficiency and ISO 14001-2004 certification for our environmental management systems. Other illustrious accolades include CA Sri Lanka Silver Award in 2014 for our annual reporting mechanism, as well as numerous global business performance and brand excellence awards that highlight our quality and solid corporate standing. Capable people with unparalleled experience providing extraordinary healthcare. This is our ethos here at Lanka Hospitals. Welcome to a warm ambience of confidence. Welcome to the ultimate health and wellness journey in Sri Lanka. Lanka Hospitals. Caring, curing.
Good evening, everyone. I welcome you to the free webinar on basic first aid and tips for physical and mental health during the COVID-19, organized jointly by the Youth Services Committee of the Rotary Club of Colombo in partnership with Lanka Hospitals Corporation PLC. We got an eminent doctor and a trainer here who I will introduce now. Dr. Charini Senanayaka is a medical doctor, life strategist, coach, health educator, and a corporate trainer. She currently works as the head of Priority Health at One Goal Phase, first ever priority clinic by Lanka Hospitals. She also oversees the outreach clinics in different corporates under Lanka Hospitals. She has worked in the World Health Organization for the last 10 years in technical project management and organizational reforms. She is a member of the Sri Lanka Medical Council, Sri Lanka Medical Association, Palliative Care Association of Sri Lanka, and an associate member of the College of General Practitioners of Sri Lanka. I take this opportunity to thank all interactors of the Royal College, Bishop's College, Stafford International, Muslim Ladies College, St. Paul's Girls' School, and Interact Club of Colombo. Also the Rotaractors of the Rotaract Club of Colombo, St. John's Kottayam Defence University, and the Rotaract Club of Colombo region for their participation, and all the youth, teachers and principals, and the public who have logged in into today's session. Let me add sincere thanks to the group marketing team of Lanka Hospitals PLC for the immense contribution in organizing this webinar, to the Youth Services Committee led by Asangi Ratnayaka, of the Rotary Club of Colombo for initiating this timely webinar, especially for you. Now, I would like to hand over this to Dr. Charani Senanayak to commence the session.
Hi, everybody. I hope everyone can hear me. First of all, I would like to thank the Rotary Club on behalf of Lanka Hospital's management and the marketing team. And for everyone who's joining us here today, thank you for participating in this. And thank you very much for the opportunity given. I hope everyone can hear me, yeah? All right, so I'm just going to share my screen with you and I'll walk you through each slide here. I hope you can kind of see now. Yeah, all right. So basically we live in these times where all our lives are dominated by a small virus called this coronavirus, right? And all of us, like healthcare workers, we are kind of, like on this right-hand side upper corner, sometimes we are invisible. We are covered with all these PPE kits. And I'm sure that some of you have experienced a PCR. You can see on the left-hand side, down quadrant, how a PCR is being conducted. So we are living in these uncertain times. And obviously, we need a certain type of adapting mentally, physically as well to these environmental conditions. Some obviously we don't have control over, some we have control over. So first of all, I will start my presentation along with some of these, sorry. Let me start off with a few areas that I see on, like on daily basis, or at least every other day maybe. As a general practitioner, I've been seeing a lot of patients who come with breathing difficulties. Now, this can happen not only in a healthcare setting as a clinic setting as mine, but also obviously in your own homes at times, because now a lot of people are living in homes as well. The main three symptoms of corona or COVID-19 symptoms are like fever, dry cough, and fatigue. Some of them, sometimes some of these patients can also show shortness of breath. And actually the shortness of breath means like difficulty to get air. And you feel a chest tightness sometimes. And it's hard for you to breathe, the normal breathing patterns. And then obviously you tend to feel very scared with the chest tightness, and you kind of get disturbed, and that again aggravates these breathing difficulties. So I'm going to walk you through, if you ever see a patient like this, if somebody in your home happen to have these things, or whether it is you've seen someone who's having these are very few things you can help until, at the very first stages, until obviously the patient gets better care by a doctor or maybe an ambulance later on. So the very first one you can ask the patient to do is, first of all, you as the person who's intervening, it's very important for you to be kind of composed and calm. If you are also going to be really, hyper up and, like feeling really taking that stress on you, it's very hard for you to calm the other person. It's very, very important. I've noticed this many times when my clients present to me, when my patients come to me. Sometimes just by calming them down, you will see that effect much sooner than other times. So a few things you can do is, if you see a patient with breathing difficulties, one thing you can ask them to do is breathing. You start breathing with the lips. So you can use this, like that. Use the mouth to breathe out. Breathe in through the nose, breathe out through the mouth, right? And this is something that will, with time, obviously, this will make it easier for the person to breathe in. And then the next one you can do is sitting forward. You should actually make the person sit. It's very, very important. Sometimes people get so worried and, they lie on these beds when they're having these difficulties. But what you need to do is you need to actually prop up, or at least, like kind of sit down, make the people sit down. Sometimes I see my teams, emergency teams, bringing these patients in these trolleys, but they're lying down. And they get hyper, worried, and then they can't breathe more because they're lying down already. If you make them first, sit down or prop up, or, like that position really makes you breathe easier. So you can actually sit forward, and then if you really want, you can also sit forward with the desk, the third one, with a pillow, right? With the head sideways. Another way that you can actually stand up. Right? If you're having these breathing difficulties, you can stand up, supported back towards a wall. You can put your hips actually to touch the wall and stand up straight, supporting with the support of the wall, and you can start breathing through the pursed lips. Sometimes you can also look at the number 5, for example. You can stand up supporting by the arms. That also helps. When these things kind of start to happen, your breathing will start to be feeling a little bit easier, that chest tightness can go off. Most of the time, just a simple things, calming down and then having these proper positioning can actually, get these people who are having the breathing difficulties have a little bit calmed down, right? And once when they are calmed down, you can obviously think about a sleeping position as in the number 6. But more importantly, if it is not settling, you can actually start instructing the patient on this number 7 diaphragmatic breathing. This is a very quick, easy way to handle a patient with breathing difficulties. So whereas you can see number 7, you can just ask the patient to sit up, keep the legs and keep the legs relaxed, on legs down with the knees, and then keep your head and other places up on your body relaxed, and one hand around your belly. When you put your hand on the belly, the meaning of that is you're going to breathe through the nose. You're slowly breathing through the nose, and you would feel that as you breathe in, your belly will move forward. And as you move up, as you take the breath, as you put the breath out through the pursed lips, then obviously you should tighten your muscles in your belly, and then through the exhalation, so that exhalation happens better, and you can get rid of some of more air out of your lungs, right? So paying attention not for the inhalation here, but more towards paying attention to the exhalation here, putting that breath out. That will help, as you go on to do this in few cycles. This will really help, and you might want to do this for about 5 minutes, and you will see that the breathing issues that the person had will, start to kind of calm down. These are some of the COVID-19 time guidelines. That's from the UK. So Health and Safety Network. So this is about everybody who's going to assist in a COVID-19 times will need to take care of yourself, because it's unlike all the other times. Now, this is something that can transmit to you as well. So you as the first aid person has to be a bit more careful than before. So you don't, unlike previous times where you would, when somebody falls down, you're going to inspect, you're going to listen to their breathing. We are not going to do those things now anymore, right? We need to keep maintaining a little bit of a distance for ourselves, obviously, because we need to minimize the breathing zone that you as the first aider and the patient will be sharing. So obviously, remembering again, the 3P model, whereas you want to preserve life, prevent the worsening, and promote recovery. First of all, as the first aid person, if you have a deteriorated patient who's not responding, what you need to do is call for the ambulance service number, or ask help from someone else to call for the ambulance. And in all these ambulances, sometimes you may have actually a defibrillator. That is very important as well at a time when the patient is not responsive. So if the ambulance has it, you can obviously ask them to bring it. Now, before you even think about CPR, and nowadays you need to obviously wear your proper masks, whatever that you can have, the surgical mask. You should absolutely wear quick gloves wherever you can get. If there is an eye protection, you can put that on, apron or something that you can find out from the area. You should always first protect yourself before you approach the person. So this is really important. And the second thing that you need to pay really attention is that when you are going to do the CPR or cardiopulmonary resuscitation for a person who's non-responsive, you need to put a cloth around his nose and mouth. I will show you before you start doing the chest compressions. In my next slide, I'll show all this and walk you through. But these are quick guidelines I just want to share with you. So nowadays, we don't do any mouth-to-mouth rescue breathings. We only do the chest compressions when there is a person lying there who's non-responsive, right? So, and once you have done the chest compressions, you can obviously use a defibrillator, which is why I mentioned that if you're calling the ambulance, it's important to inform them if they have a defibrillator, bring it along as well, right? So once when you have done all the process, remember you need to discard your disposable items safely, right? Mask and all that you were wearing. If there are clean, reusable items, you have to clean them properly, right? And then obviously you have to wash your hands with soap or use some alcohol after you've finished the procedure and handed the patient to the ambulance. Now I'm going to guide you through very shortly, very briefly. Now, an adult who is not responsive, who's not breathing normally, that's the time we will call an ambulance, right? That's the time you will know the person is lying there, not responding. Even if you talk to them, hello, how are you? Nobody is going to, respond to you. So you know that is the time you need to intervene. So there. What you would be doing is usually this CPR are two components, as I told you earlier, chest compressions and rescue breathing. But due to this COVID-19 outbreak, we do not perform any rescue breathings on the casualty. And usually when you do, as you can see on the right-hand lower corner, you can see that is how you will put pressure on the person's chest. So with both fingers interlinked. And when the depth of it, when you go down onto the chest, when you're doing a chest compression, usually make sure that at least a 5 centimeter depth, you're pushing it through the chest. And you have to keep doing this until the ambulance arrives, right? Because if the person is not responsive. Here again, the steps, very quick: call for help, 1, 2. Before you start the CPR, I mentioned earlier, you use a towel or a clean cloth on the nose and mouth of the patient, right? And then you will be doing the chest compressions. Then hopefully the ambulance has come by that time. There is a defibrillator and there are processes that ambulance people can help you to put that forward. Meanwhile, before even if the ambulance come, if the patient is responsive after doing the chest compressions, put him onto the recovery position. So you turn him onto the lateral position, right? And keep, as long as he's responsive, put him on the recovery position. You can keep him until the ambulance comes. I think we will be taking a short break to see some videos now, before I move on to the more in-depth discussion about physical health and mental health, how to look after physical health and mental health.
Rotary is an organization which is spread over 200 countries and has got a membership of over 1 million. And it connects people across the world, work together for humanity, to establish better contacts. Why even do business together? I can honestly tell you that I am what I am because of Rotary.
Rotary had always been like family to me. I was an interactor while in school and then a rotaractor, and naturally I joined a Rotary when the time is correct.
It's absolutely fascinating the reach that Rotary has. When you say that you can go into 200 countries and walk into any meeting of 35,000 odd Rotary clubs.
I joined this club in 1971, where we consisted of very senior members who were of great value for the society and for humanity. We have done so many humanitarian grounds, sanitation, drinking water, polio immunization.
When Rotary started on polio, we were at 1,000 cases per day around the world. Today, we are down to less than 100.
The Cancer Prevention and Early Detection Project, it's one of the flagship projects of the club and one of the longest running projects. We complete 15 years this year. Up to now, we have screened almost 74,000 people.
The most impactful one for me has been in 1988 when we started an international program sponsored by BBC called Follow Me. It is an English teacher training course. We, the Rotary Club of Colombo, had 3 outlets, 3 centers which we did this. And the one in Barbuda won an international award by BBC as the best model of success in this program.
In a world where everybody was concentrating on going to school, going to university and getting a degree, there are people who couldn't, for different reasons, couldn't get up to that level, and they went into something called entrepreneurship. And we started a project in Bavania. Bavania was just after the war, 30 years of war, and the people there definitely have missed the school education, but they knew a little bit of agriculture or trade or business, and they need a recognition, direction, managing their affairs. So we thought it was fit and proper for the Rotary Club of Colombo to pitch a program with the help of local and international support.
In recent years, the contamination of the groundwater in the north and east has resulted in a sharp increase in chronic kidney disease. We were called upon by the Ministry of Health to try and help to alleviate this problem by the provision of clean drinking water plants based on reverse osmosis technology, commonly known as RO plants. The 29 plants that we have provided can cater for a population of about 90,000 people. We believe that at least 75,000 people are currently benefiting from these RO plants.
So then we went on this trip to Jaffna. We saw what Rotary did to the people there by giving something simple as water, like a well. And then we wanted to do more work together and contribute more.
The tears in their eyes when we went to open the wells and their blessings, the prayers they did, all that, we realized that how much we take for granted.
I encourage you to join Rotary because it benefits you in more ways than one. It elevates you, elevates your character, and you become a better human being because of Rotary, its philosophy, and its principles. Rotary is an organization which is spread over 200 countries and has got a membership of over 1 million. And it connects people across the world, work together for humanity.
All right, so we are back again here. I'd like to walk you through some tips in terms of taking care of your physical health in this next session. It's very important that we look at what is immunity, because everybody talks about immunity these days, right? People who are having a good immunity have less risk or less chances of being victims to COVID, right? So what is immunity? So this immunity itself is a very complicated kind of way to explain, but it's an utterly important for our survival. So basically all you need to know is that when immunity is the ability of any organism to resist a particular infection or a toxin by producing all these antibodies and synthesize white blood cells that will protect you as the host from these outside threats. So immune system is absolutely essential for our survival. So I will walk you through a few bits and pieces about different types of immunity. This is very basic touch base only, but for you to just know there are 4 types of immunity. So one is innate immunity. So you're born with it, with that immunity, right? With that is called innate immunity. So that is in your skin, obviously the mucous membranes of the throat, the gut, all that. And then you have adaptive immunity. So adaptive immunity is something that when you get a disease or when you're exposed to that once, then you kind of build up antibodies. So then you will not become again sick to that kind of diseases, right? So that is adaptive immunity. Passive immunity is like a mother who's breastfeeding the child, the baby. You are passing through the breast milk the passive immunity to the child, right? So that is passive immunity. So you're borrowing that immunity from another source. Last but not least, immunization. So that is happening loads of times now. You hear a lot about these vaccines, right, for the COVID. So that's where you're kind of building building those antibodies by injecting yourself with weakened pathogens. And then you build the immunity antibodies inside your body so that when the actual virus or the other thing comes, you come into contact with it, those antibodies recognize, oh, I'm under threat, I need to really, start to save myself. So, then the fight goes on, and so you don't become sick. During these COVID times, unlike any other times, we need to really pay attention to keeping up with our physical health, right? So how can we keep physically healthy during this time? So obviously, I know that a lot of us are at homes, even working from homes. Kids are schooling online. So most of the time you may be at home. So that means you have access to the fridge, you have access to all type of food. But it's very important that you kind of pay attention to these diet rich in fruits and vegetables. So you can have some sweets, obviously, but not like you're not going to binge on sweets. It's important that you have a balanced diet, have a considerable portion of fruits and vegetables that gives you particularly vitamin A, C, D, and then zinc, right? So you need to exercise regularly. I'll have a slide later on that. Maintain a healthy weight. Now, when you are at home, sometimes you don't understand or you don't pay attention how much you are eating. And you can obviously gain certain weight because of that. And then obviously during COVID times, you may also not go out and, do the physical exercises. So again, you're increasing what you're taking into your body and you're not burning adequately. So then your weight parameters can, really go haywire. So pay attention to your maintaining a healthy weight. Smoking, if you are in the home settings, you're not working from an office, you might, if you are a smoking person, you may want to do it more often because you're stressed, a lot of things. But this again will put down your immunity. So pay attention to, quitting your smoking and then obviously if you're drinking alcohol, then limit those habits. Make sure you take enough sleep. Most of these children, for example, watch movies until late night because we are home, right? But make sure that you need proper 8 hours sleep if you want to maintain your immune system during these times. And your immune system is the key, probably the only weapon you will have against this COVID-19, right, virus. So avoiding infections, and you have to obviously adapt good hand washing techniques, proper masking. I'll go through each of those in the upcoming slides. And in terms of your supplements, you can look at something, supplement wisely. So you can take some vitamin C. If you're not going out much in the sun, you're not getting the sun onto your skin, then maybe vitamin D supplements and probiotics, things like that, right? Pay attention to your diet. This is the key. So you need to pay attention to fruit, taking a lot of fruits, vegetables, nuts, those things. Then know that your gut, inside your tummy, inside your gut, has a lot of bacteria. So you have to grow them. Those will help you a lot in terms of your immune system as well. So paying attention to your gut bacteria, so eating a lot of yogurt will help you. Then obviously things like olive oil, salmon would help you as more healthy fats. As I told you, yogurt, curd, all these kimchi, all these things are fermented foods, help in terms of the probiotic supplements, right? Limit your sugars. Sometimes we tend to eat earlier. If we were working, maybe we will have one piece of a chocolate. But now when you're at home, open the fridge, we take the whole, bar of chocolate. So you need to be careful how much of sugar that you are consuming. Too much sugar, again, put your immune system down, right? And most importantly, pay attention to your water levels. How much water do you drink every day? Do you at least have 2 liters, 2.5 liters? How would you know that you're taking enough water? Look at the color of your urine. If the color of your urine is pale and whitish, then obviously you are having enough water that you require within that day. But if you are having darker urine, very dark yellowish or even more darker oranges, well, obviously you need to have a lot more water in your body, right? Remember, our bodies are made nearly 70% from water. All that blood that goes through our bodies, it's made out of, majority of it is water. So if you don't take enough water, these things can become thickened inside your body. And then again, it doesn't flow as much as we would like. And then you will not have enough benefits of having all this oxygen going and moving around, all these white blood cells, like working to your own benefit. So that's very important. Don't forget, even if you have a small garden, if you can't go out during the corona times, everybody says that you need to keep, stay inside your homes. That's fine. Make sure that you can at least go into your own gardens, walk across the small street that you have, get yourself, moving. If you don't have your own home gymming equipment, you can obviously walk. It's free and it's quick, and it will still give you the same benefits, right? It's important to pay attention to your hygiene habits. So we've talked so much and so many times about these, washing your hands with proper soap and water, using alcohol or sanitizer. And when you go into these public places, whether it's a public bathroom, whether it's a lift or even pharmacy counters, try you not to touch them too much. And if you have to touch them, then you could always use a tissue, for example. Keep a bottle of sanitizing liquid inside your bag. Sometimes a gel-based one will not dry your hands up too much if you're using it often. So these are very important. Make sure that you cover your mouth and nose. If you are sneezing, these are just personal habits that you could always adapt, that will protect you and protect the others around you as well. Remember, these are high-risk behaviors. I need to point out during outbreaks, it's very important that we stop this transmission from a person to a person. Some of these companies, if you look at how the whole people got infected, it was probably through lunchrooms, because you have these group lunches, because you're friends, you want to keep in contact, and all that. But remember, it's important during an outbreak situation, these group lunchings, these mask off times that you're talking to somebody, these are the highest risk times to yourself. So pay attention, don't compromise yourself in these situations. And then practicing hand hygiene techniques. I'll walk you through the WHO guidelines shortly in terms of hand washing techniques. Again, paying attention to physical distancing yourself, social distancing, or physically distancing yourself, having that, if you're in a queue in a bank, for example, leave some room between the first person to your, between the front person and you, at least a 2-meter distance. Then proper masking is important. Sometimes you like to wear a different mask than a surgical mask. Some people find it very boring, using this blue surgical mask all the time. You want to wear a branded mask, a cloth branded mask. Well, that's fine. If you have to do that, make sure that you wear the surgical mask inside, and then you can wear your branded mask on top. So you're still going as double masking, and but you're still getting protected, right? Because surgical mask has been built in to cut down certain, the permeability ability of these viruses, to cut that down. So that helps monitor and keep those in check, those viruses entering your body, right? And if you're having ACs and in your workplaces, make sure those that you pay attention to, cleaning those air condition things, as well as if at home, it's very much needed. These open your windows so the air will, move through, and you have proper oxygen, everything, right? Okay, here are a quick few steps how to do proper hand washing. So you can see, first you will open the sink tap, and then you will take the liquid wash into your hand. And first you will start with your palm, right? And then obviously you need to put in, you have to put the palm above the other, and then make sure this in between these areas are clean, right? Then you can interlock your palms and then clean the inside areas of the fingers. Remember, we didn't do the thumb. Now it's your thumb time. And then here, actual palm and the fingers of the other one. And then you have to do that both. And then obviously you wash hands. And once when you wash hands, it's advisable that you use a tissue to close the tap. Now, then you know that your hands are safe and you've washed them properly. Sometimes we forget using the tissue, and we kind of, again, after all doing all these things, we kind of, go and finish off, putting that tap off with the same thing without even touching, using a tissue. But then again, you might be, again, getting all those bacteria or whatever viruses inside onto your palms again, right? So this is just WHO approved ways of hand washing techniques. So you can do, when you wash your hands, take at least 40 to 60 minutes for this procedure, so that your hands will be clean following this. So masks, it's important that I know that we all know, we hardly see each other's faces, right? We always see people wearing masks. So how do we wear a proper mask? This is very, very important. So you need to actually wash your hands before you wear a mask. If you're doing it, inspect your mask. If there are any holes in it, that's important, or tears. If that is the case, you have to obviously take a new mask. You can place it properly onto your face, covering your nose and mouth, and then you can put that up. And then most of these masks have this on top, you see? Here. So the nose bridge, it's very important that you touch and adjust that to the face. Now, some people have these masks, some people, it's too, not too tight for the face. And if that's the case, you can just adjust it by doing this, like that. So hold on, I'm just wearing, there you go. So just adjust it over here, and then you can always, if your mask in the face, distance is too much, you can do it like that. If you have to remove it, remember, as much as possible, don't touch these during the time that you are wearing the mask. And if you have to take that out, take it out from the back. So just give me a sec here. I'll demonstrate that again. So there we go. I put that one in, I don't touch, and then I need to take it off. There we go. Just take that out. You have to take it from the back. I'm wearing glasses, so sorry, this gets stuck all the time, but you need to take it out from the back and keep it there. And if you are eating foods, for example, then leave the mask. You can always have a sealable plastic bag and you can put that in and keep it on the desk, or you can take some tissues and rest your mask on top of it. And then once when you're done, you can obviously wash your hands after you wear the mask. So that is important, right? It's important also that sometimes when we are wearing the mask, people can't hear most of the time. People cannot hear, feeling muffled, voice would come in and you may tend to want to take this out. But if you are in groups, as much as possible, make sure that you're wearing the mask when you're talking. All right, so I think we could move on to the next part of the last part of our this presentation, so which is taking care of your mental health during COVID-19 outbreak times. We are very, it's very important that we understand that we are going through these rough times, and it's none of our fault. Obviously, it's an environmental thing, and we just have to adapt and take our lives forward. Just like anything else, this will pass over time. But until that time comes, we just have to go through with this whole thing, these adaptations, right? So this is very important. Now, most of us feel anxious about whether I will get COVID, whether my family members will get COVID, whether our children will get COVID, right? So knowing that these anxieties are there, obviously, and understanding that it is not only you, many others also go through with these kind of anxieties, and that is kind of natural in these times. But what's important is that you do realize that you are having these anxious thoughts, that you do something that you can control about. And there are things that obviously that you can control about, as well as there are things that you can't control. So then making that conscious choice to choose what you can control, what you can make an impact. It's important, because if you're going to be only considering on the things that you can't change, then you're going to get more anxious every single passing time. So first, understanding your anxiety, it is normal these days, these times, and it is not only you. A lot of people go through this, and it's a normal, natural thing. Stay informed. Stay informed about the COVID-19 situation, but don't do it obsessing as like an obsession on news, for example, right? Because sometimes the news is dominated with so many negative things about how many people are dying instead of how many people are surviving, because that sells the news, right? So it's important, and looking into these, there are lots of information that's passing through all these WhatsApp and other channels, the social media channels. Important thing is knowing the sites that you can go into. So World Health Organization site is a very good site, and it has even courses on these COVID-19, about the disease itself, about the vaccines, disease progression, what you can do to protect yourself, your loved ones. So maybe take time to browse through those sites. Then Center for Disease Control, your CDC site, again another vital website where you can actually learn good scientific things about this current situation. If you ever feel, while you're listening to news, if you're feeling a little bit your heart rate going up, or some certain problem that you feel that you're feeling overwhelmed, walk away. Walk away. It is not a mandatory thing that you finish the news from A to Z. You can listen to that, but just walk away until you feel, get yourself under control. And also be very careful, particularly people like to, keep on sharing things that comes to you on WhatsApp messages. So be careful what you send or send out to the others, right? So, because you might be adding to someone else's distress, someone who is already distressed, you can be adding on to that. Again, I was telling you earlier about like having to focus on things that you can control. So what are the things you can control in a situation like this? Obviously, you can't control the COVID-19 virus coming near you or near your loved ones, but what can you do? Obviously, you can stop the transmission or reduce those transmission times, high risk times to yourself or your loved ones, right? So that is by washing your hands, staying at home. So some people obviously want to always go out and go to spend time with your families and friends, which is right. But then again, you don't know if they are exposed by someone else at this time to COVID-19, right? So unless it is really essential, make sure you stay at home and avoiding crowds. Sometimes some people still want to have parties, right? So again, avoiding crowds maybe to a certain degree will help you with this. And if you can do your shopping by ordering online, do that. And getting plenty of sleep. So pay attention to those things that you can have control on. Then obviously, if you're still having a lot of worries build up in you, maybe you can do a worry list, right? Just like we do to-do lists, you can do a worry list. Try to see what comes up with it. Why are you so worried? Write down 1, 2, 3, 4, 5. Look at the solutions to each of them. Is there anything that you can do? So once when your chart is not only the worries, but also you break them down into what you can do as the solutions, then it's time, obviously, you pick 1 or 2 or 3 of them and start taking actions on those things that you can do something about. You are taking action on not the problem, but you're looking at the solution, right? So that will also, again, ease up some of this anxiousness that you feel. And obviously, we do talk a lot about being physically distanced, but it's very important. We are social birds, we need that connection. We need to connect with people. We need to talk to people. So that is okay. And thank God, we have the technology, which is like today, which is unlike 50 years ago. You're a call away from a friend. So make sure you do stay connected. You try your best, even at the worst times, even as healthcare workers, sometimes we are so busy. But if you can at least drop us, like an SMS to somebody you like, or someone, your family, for example, do that whenever you can, when the time permits. And then you can obviously take video calls. It's free now. So keep connected. Call your families, call your friends. Maybe it is a time, actually, you can renew those friendships that during your school times, that you had. Maybe it is time that you call that friend whom you never had time to call. And maybe paying attention to a hobby of yours, maybe you didn't have time at all this time. You were so busy, studies, your work. Now that you're having some time at home, maybe it is time you can start up that the drawing that you were doing, the short story writing that you used to do, the singing, the playing the violin. I've seen loads of people uploading things when we are socially isolated or in maybe like lockdown periods on social media. Some of them are playing guitar, a song, maybe some of them are singing. So those have been posted on social media. So those are good parts of having social media connection. I just have 2 more slides. So this is about balancing your time. Nowadays, it's like this COVID-19 has changed us a lot. How we work to how we educate ourselves. Everything is turned upside down. We work from home, right? This is like the new norm. Now, working from home as adults or studying maybe from home, for example, where you used to study in a library. Now it's like you have to do everything from home. So then how do you manage that with your siblings, with the children? How do you manage that? Because people tend to get very stressed sometimes working from home. You have targets, you have goals, then you have all these meetings, and yet you have your children, coming onto your lap. children wanting attention of yours, doing their homework. So I think it's important to look at this whole and work towards a flexible kind of a working patterns. So having realistic goals, what are the things that you may need to do today? So 1, 2, 3, 4. Those are the top urgent ones that you need to do, right? Then having to set up an office workplace. This is very important because when you have an office workplace, naturally it really helps you to concentrate, your body to concentrate on your maybe that particular meeting or maybe writing that report. So that is important. Then being sometimes you need to also be a little bit flexible, because sometimes you may try to put the children out and try to work on it, or try to not to have pay attention to your siblings, and you're going to try to kind of work on that, but that may be not all the time going to be happening. So if that's the case, being a little bit flexible on your schedule, if that works, that's fine. If that doesn't, maybe you will ask for like a 10-minute delayed starting meeting time, maybe that you can do this. Staying connected. Sometimes one of the major stresses that people have is when you're working from homes, you don't really quite know, sometimes when you're like really, you don't really quite know, quite haven't been explained that coworkers, what exactly is needed from you. So then it's another issue that you really need to look into. You have to explain to your coworkers the particular expectations of you, because sometimes it's a misunderstanding. It's not the same as, you know, talking to someone face to face. Here you need to probably have to be telling them what exactly you want and what are the kind of rough deadlines. So it's so that the work or the task is very clear to them. So then you can stop and go away from all these lot of misunderstandings later on, right? And when you are being at home, you don't have to be the teacher of the year. You can help support, you know, the children, but it doesn't mean that you have to be the top parent who will be doing and helping them to A to Z to be the top child in your whole class. You can do what you can. Obviously, you have to support them as parents, but maybe not to a level that, you know, like try to manage those expectations within yourself. What are the areas where you will have to play a role as a mom, obviously in your online education, the homework, all that. But at the same time, you are also a working person who would need certain support. All right. Last but not least, I'd like to move on to the online education and children. So this is something that is like really for everyone. It's about online education these days, right? Starting from the school education to the outside extra classes to even the physical education, right? The PE. So what we need to look at now under these circumstances is it's important that you do kind of, when you are so much, maybe like sometimes around 6 hours or 5 hours on a computer, you're going from one class to another, maybe you're being too much, you know, exposed to the screen time. Maybe that is the time you need to also look at and manage those gaming times that you do, online play things that you do. So those can be a little bit quarantined or a little bit away from them, because now your timings and your, before you used to go into physical, you know, physically go to a school and study, but now you're doing everything from the computers. So maybe you can go down on a little bit about those playstations, playing items, you know, online play games. So you are paying more attention to the online part where you are studying, but go away from all the other online things if you can, and or have those in little bits of pieces. Instead of that, go out into the, you know, like do some, maybe go biking in the garden when you have time, play with your sibling when you have time, so that you are adding on those times that's away from your screen as well. So you're balancing that, and it is very important for your eyes. So sometimes if you're having the screen and you're looking at the screen for hours, it can make your eyes very, very tired. And a lot of children nowadays need glasses. So it's important that you advise them to look outside. If there is a window outside, you can look far so that you can rest your eyes as well between these online sessions. And then obviously you'll have to monitor the screening times of the children. Instead of before, we probably came down to play a game, and now it's like setting an alarm to go out and play, go out and bike, you know, all that. And last but not least, it's important that you encourage your children to stay connected with their friends. They are kind of isolated nowadays, unlike, you know, for about a year and a half now, we've been inside the houses and they haven't had those bondings with the friends. It's very important that we do advise them at certain times and maybe use these FaceTimes, keep in touch with them over a video call. So, you know, they keep those bondings going on to the next years as well. This is very important. So the children don't get isolated only within the home times, but also still you can encourage them to adapt under these circumstances and still keep up with their friends. I think I've almost covered most of these areas from the first aid, the most important tips on first aid, as well as I also briefed you on a bit of some tips in terms of how to keep your physical health and mental health in top notch during these COVID-19 times. So thank you. I think we'll be having some questions later on and to these hotlines or via Facebook. So I'll be happy to answer those as well. So as the last step, I would like to actually thank Rotary Club for having this opportunity given to us. And obviously on behalf of Lanka Hospital's team, marketing team, as well as Lanka Hospital's management, thank you very much for this opportunity to be connecting with you and sharing some of these new information with all of you. So I hope that we've shared some valuable information with you. And if there are any questions or queries, please reach us on Zoom and Facebook and any other platforms that we were on. So thank you very much for joining us today.